So we're just going to wait another minute or so, and then we will go ahead and start education now. All right, we'll just start up in just another couple of seconds. All right, well, we are going to kick things off because we have a lot to talk about over this next 30 minutes. Good afternoon, everybody. My name is Francesca Purcell, and I am the senior lecturer and faculty co-chair of the higher education concentration at Harvard's Graduate School of Education. And I should say good afternoon, but perhaps depending upon where you are in this world, good evening, good morning, whatever works for you. We're really happy that you're here to join us. I want to welcome you to Education Now, which is a webinar series designed to respond to some of the dramatic changes that we have all been dealing with in the field of education during the COVID-19 pandemic. And in today's conversation, we're going to discuss the growing need for mental health and wellness support for our college students, some of the key factors contributing to this situation, and how universities are both anticipating and responding to student needs. Just so you're aware, today's episode is being recorded, and if you want to get access to that in the future, you can go to our Education Now website. We very much will look forward to interacting with you through your questions, so please feel free to use the Q&A button at the bottom of your Zoom screen, and you'll also find closed caption access there. So now I want to welcome our speakers. Dr. Ernesto Escoto is the director of the Counseling and Wellness Center at the University of Florida. He is a licensed psychologist and clinical associate professor. Welcome, Ernesto.
Thank you.
And also we're being joined by Dr. Nicole Green. And Dr. Nicole Green is the executive director of counseling and psychological services at the University of California, Los Angeles, also known as UCLA. She's a counseling psychologist, and I'm also proud to say that she is an alum of HGSC. So Nicole, welcome.
Thank you.
I do want to thank you so much for taking this time to be with us. I'm sure with each of your positions, you have a lot of demands on your time. So to be with us, to share some of your thoughts about this, it's just such a gift. So thank you. So Ernesto and Nicole, I mean, many of us in the field of higher education have had have been reading about, experiencing so many alarming statistics about the mental health needs of our students. So for example, the Healthy Minds study, which comes out every year, most recently found that just over 40% of students have screened positive for depression. A third have screened positive for anxiety. Beyond that, many students are experiencing essentially academic distress, having various mental and psychological challenges that affect their performance. So tell us a little bit, what are you seeing on your respective campuses and how is that playing out? So Nicole, why don't we start with you?
Sure. I would say no different than much of the country. The students at UCLA, there's a lot of depression and anxiety. Our counseling center is very well utilized with over 15 to 16% of our student population seeking services. There are often long wait times for clinical care. I think that the demand for individual clinical care is high, despite our attempts to provide them support with peers, with mentors, with group therapy. I think the individual confidential care is really what their favorite choice of support is. I will also say that while we are focused on the college counseling center crisis and mental health, I do want to acknowledge that this is a worldwide crisis that we're in right now, which is in the K through 12 system, in the prison system, in the private sector, in the county mental health system, in the VA system. I just think we're really looking at a time where folks are really focusing on mental health for the first time in big waves, and we've just been under-resourced to meet the demand. So I think UCLA is no different than other college counseling centers, but certainly we are seeing the high demand on our campus, and the demand for service is consistent and constant throughout the year. There used to be breaks in the summer. I'll say there are no breaks in the summer these days.
Yeah, that waiting demand is certainly, we see that sort of on a regular basis. So Ernesto, How about at the University of Florida? How are things playing out there?
Very much like what Nicole was describing. For the last 6 years, we have seen an increase in demand for services at the rate of 6% annually. We currently serve about 10%, 11% of the student body at the counseling center. Anxiety, depression, stress are the most common concerns that students report. And with the exception of 2020, that was the only year because of various changes that had to be implemented as a result of the pandemic. We didn't see the typical increase that we have been experiencing of 6%. But this year, students are back, and the demand for services actually outpacing 6%. I think we're in the 8 to 9% increase compared to 2019 numbers, which is, it feels as if the students are making up for the year that was lost in 2020.
And Ernest, I'm going to stick with you and then come back to Nicole. So talk to us about what do you think are some of the, I mean, we're talking a little bit about that pandemic. So I'd love to hear a little bit more about your thoughts about that, as well as any other contributing factors that we're seeing more and more students, essentially having these experiences. What's driving this? What do you think?
Yeah, I think that if you talk to different experts in the field, everyone is going to have a number of, suggestions about it. Increased awareness is one of them. Counseling centers especially invested heavily in outreach and education over the last 20 years plus. And we're seeing the impact of that. Students are much more aware of how to identify, mental health, related symptoms and experiences, and also aware of the services that universities provide. That education is also happening in the families, K through 12 system, medical providers who became much more well-versed in mental health and begin to talk to families about the need for mental health care, as Nicole indicated in terms of the increased demand that we're also seeing in our communities for services. But obviously there is the issue of stress. A lot has changed in the last 20 years. Society is moving at a much rapid pace. A lot of the milestones that students used to face in the late teens, early 20s, now they don't have to face them until the late 20s, early 30s. Oftentimes, those crises, provided us opportunities to develop meaning about life, whether that was, partnering for life, with someone, or getting married, having children, entering a formal job. Now, students typically will have handful of jobs, if not up to early, low teens, before they actually settle into one particular, career. And so it's a lot of different factors that are contributing to this.
Yeah, and Nicole, just sort of building on Ernesto's thoughts, what are you thinking about this?
Yeah, I definitely agree with everything Ernesto said. I think obviously Gen Z, which is sort of aging out of college now, some of the things that they faced being born between 1995 and 2010 with 9/11 and gun violence issues, global warming issues, the recessions that we went through, the political discord. I think these students have been given messages about how much doom there is. I think they've been, as I understand it from the research, somewhat divested from traditional political processes, with more grassroots movements around BLM, Me Too, but also I think they received different messages than we did around being one of a doctor, a lawyer, a teacher. Now it's sort of like, be a special influencer, be the top of the mountain, be on your own, like you have to be the only one that's ever done this thing. And I think through social media that gets perpetuated. I think the other thing that gets perpetuated through social media, of course, is like the curated life that happens that you think you have to live up to, but also the constant exposure to the trauma around the world all the time. Mm-hmm. So I think all of this, the high stress, the we-centric, the very caring nature that they are, but on top of it, a lot of stress and pressure and a lot of anxiety and stress, sort of like turtle no shell, like lots of feelings of like, I don't know how to manage this. And I feel very exposed and I'm not sure I have all the tools, And I think there's a lot of debate about how resilient this generation is, because in a way they're extraordinarily resilient. But there are also ways in which managing mental health has been hard. And truly, it's not just the stigma reduction, as I'm understanding it, the true incidence of depression and anxiety is higher in this generation. So I think there are a number of factors, as Ernesto said, and I think they're playing out on the college campuses. And with our great outreach, we're just hearing a lot more about it. And students are talking about it and really demanding the care that I think other generations have wanted and they haven't been able to access.
Yeah. And, from listening to the both of you and the different understandings you have of sort of what's fueling this, it strikes me that I don't really see any end game to any of these things coming anytime soon, that this will continue to be a world where we're dealing with the pandemic for years to come and its impacts, particularly in the United States, the racial and social strife that we're dealing with, the political divides, the social media, even though, the government's trying to put a little constraints on the likes of Facebook, but I don't see that sort of really taking deep hold. So I think, this is a world that we're all having to contend with for some time to come. So, given all of this, and, one of the things we try to do with education now is think about what are, actionable ideas and things that different campuses are doing. Tell us about how you've been responding and anticipating and sort of dealing with all of these demands, these very high demands at your respective campuses. So Ernesto, let's start with you at the University of Florida.
Yeah, because of the size of our campus, one of the things that we did about a year and a half ago was to actually do some benchmarking with other, large university counseling centers and see what they were doing as a way of meeting the increased demand. We ended up landing on a model that UT Austin has implemented. They have what they call the BAR team, and essentially at UF ended up being called the CAR team, Consultation, Assessment, and Referral team. And so we went ahead and hired 10 counselors, and all they do is triage. Essentially, this is like an emergency room. And every time that they meet with the student for 20 to 30 minutes, the way that they triage is by identifying those immediate resources that will use the least amount of time or effort, that are still appropriate for that individual, sort of a step care model. And that has allowed us to actually decrease our wait list. Right now, I think we're in week 10 or something of the semester, early November, and we only have 6 people on our wait list. In previous years, late September, we already will have a wait list in place, and it will be probably 2025. On average, students wait about 6 to 7 business days, on the wait list. And so it's turned out to be something really helpful. And I say that cautiously because I'm not, trying to suggest that this is the one solution for everything. Things change so rapidly. And I just hope that it has a lasting effect, but that's one of the ways in which we've been trying to address, demand on our campus, just being more kind of smart, about how we use our resources, implementing a step care model, and the CAR team has truly been really helpful over the last 18 months.
Right, that sounds amazing. Nicole, how do you see
Yeah, it's been a multi-pronged approach. We also have a triage model, much like Ernesto's, because we were finding, you're coming in and with no way to assess who's most urgent. Like you pick up a phone, maybe you get an appointment in 3 weeks, but someone caught a cancellation and then they get the same day. But the first one had suicidality or suicidal thoughts. And the first one had maybe like a concern about with their professor, and not that, and those needed to be triaged differently. So we also employed a triage model with clinicians who just triage and put our students in where it's most appropriate, either emergently same day with a clinician, or they can wait 3 or 4 weeks for an appointment, which is hard for a student. We're on the quarter system at UCLA, so that's half the quarter. So I don't know that we've cracked that nut. Some of the other things that we've employed are really thinking about where we're changing the culture of mental health. So I oversee not only our counseling center, but a resilience center that really thinks about how do we teach students about thinking about their mental health as a daily practice. We've done a great job in telling people how to manage their health every day. You don't just manage it on the day you go to the doctor, but you manage it every day through diet and exercise and sleep. But what about your mental health? So we teach strategies on managing your mental health. I try to help students really engage in things like meditation and yoga and mindfulness and provide an opportunity for that. I think traditionally counseling centers have been one size fits all, and everybody sort of starts there. If you have a feeling, go to CAPS is kind of our mantra, was what was happening in our counseling center. And really how faculty can help students manage feelings, how other students can talk to students about managing feelings, especially student leaders, and giving that peer-to-peer education, even if they don't want to be in a formal program. So we've tried to build out our self-help, our resilient services, and then use the clinical care and help educate the campus about when clinical care is most appropriately needed. And we're lucky enough to be in Los Angeles, I have to say, with a hospital right there for our most intensive students and community providers in West LA who do private practice. So I've been trying to work as a clinician over the last 6 years and as a leader to think about what's the whole gamut of resource rather than just the 60 or some odd clinicians I have in the counseling center doing various things. So that's been fairly innovative, and trying to think about how to connect prevention education to counseling care to crisis management and how to make them all work together. And I think it's a long haul to try to make them all work together, but trying to help the campus understand that mental health is bigger just than our clinic. So I think that's one of the innovative strategies that we've been using, in addition to the triage model, and not everybody gets the same care at the same time.
And Nicole, I'm thinking as you're speaking, right, like this issue goes well beyond, right, the clinical situation across the campus and then beyond our campus. So how do you two think about, if you even have the capacity, or at least sort of very generally, like beyond our college campuses, like I'm thinking about K-12, I'm thinking about how, and on our campuses, how do we bring in faculty? How do we bring in, other groups, so it's not all on the shoulders of clinical services to sort of address this need? So can you talk to us a little bit about, like, beyond campus borders, what are ways to sort of provide, some both prevention and awareness around these issues?
I think one other thing I'll add, which is related to this, is it's not a one size fits all. I'll say again, there are marginalized communities in our campus, with saying that we have different racialized intergenerational trauma issues that we want addressed as well, and EDI issues. So a good thing that I think K through 12 is really the education about mental health, so that people understand where there are healthy behaviors, where people are kind of in that yellow, if it's green, yellow, red, like the green zone, the yellow zone, teaching skills to de-escalate. There are lots of school issues, K through 12. The folks that do that work, I'm just always in awe, because it's sort of like, take in everyone and really manage their mental health, manage their academic success all in one place with limited resources. And how are you teaching students how to manage their emotional, if they're dysregulated, how to regulate them, how to use mindfulness techniques, how to manage conflict, and how to embed these in just the everyday life of what students are learning, and helping teachers have the resources to be able to manage that. So we're really, really educating very early on how to manage anxiety and depression, so that it doesn't result in real high need by the time they get to college.
Thanks. Ernesto, anything you want to add to that? And
Yeah.
and then we're gonna start bringing up some audience questions.
Yeah, absolutely. I think one of the first comments that Nicole, that you had, Nicole, was about this is a mental health crisis that really touches every aspect of society. And maybe collegiate mental health has been at the forefront of things because of the media coverage, but the pandemic is really bringing to the surface the very fact that we need to be working at all levels, or all, in all spheres, spaces of our communities, of our various, societies. K through 12, improving mental health services, that's going to help us as counselors, psychologists working in a collegiate, environment. Students will come to us better equipped, maybe already having some basic skills that we can continue to enhance as they transition to their life, in college and beyond. And so they don't become a sort of a burden to society, where society also has to continue to provide, sufficient mental health services for students or professionals in that sense to be able to thrive, in their careers. Within the campus, one of the things that our Board of Governors mandated for all the state universities in Florida was that all faculty and staff are expected to take the Cognito program. Cognito is an avatar virtual sort of a web-based program that helps faculty and staff develop basic skills in how to support students in distress. And so that is now mandated across the state level for all faculty and staff. And we're in the process of actually mandating that type of training for all students as well. So students will continue to develop some basic skills in being able to help one another and identify the appropriate resources and helping the students activate those resources so they can, get the help that they need.
Thank you both. So I'm gonna take a few questions from our audience members. Are you two ready for that?
Sure.
All right. So so one of the questions that's coming up is, what mental health trends are you seeing in students of color and first-gen students? Any statistics on mental health stigma within these populations?
I think some of the things that we have known for some time, especially for Black and Latinx identified students, is that oftentimes they're reluctant to seek services from established, mental health providers. There's a lot of stigma associated. There's also been a lot of institutionalized racism embedded in some of the practices of providers in the past. And so I can really understand, that reluctance. And what typically happens is that by the time that they come to see us, they're going to be presenting with much more severe and chronic mental health concerns. So it's going to take additional resources, for us to be able to help them. The pandemic and all the racial violence that we have also been experiencing, and that maybe we're just much more aware, in the last 18 months, has also, impacted the life of BIPOC, students in very unique ways. And they are the ones who are presenting with higher levels of depression, anxiety, and stress in our counseling centers. Yeah.
And just to add, I see the same thing at UCLA, that, we are almost seeing a tale of two pandemics, where if you went home, you had a lot of resource, you were like doing okay, might be isolated. And of course it was a pandemic.
Mm-hmm.
But I think for our BIPOC communities, particularly lower income BIPOC communities, this was a very different pandemic with lots of stress, lots of factors that were intersectional. Obviously, there was a disproportional impact on Black and Latinx folks in the pandemic with regard to loss and grief, and the racialized trauma highlighted so much of what we already knew to be true, but now it was talked about in this ethos. And the question is, where's the help? And I think for us, as we saw during the pandemic, a lot of need for community healing. I did a lot of community healing spaces and interventions, and working with some of our community identity centers on campus to try to meet people where they are, and also not pathologize a normal reaction to an extraordinary circumstance for a lot of these communities and colors, and saying you need individual therapy, but mostly we need community healing and witnessing, because we're highlighting something that we've been living in silence with in this very abusive way. And so the gaslighting was really something that we addressed quite a bit, that, finally there's some acknowledgement of all the pain and trauma, and not that this is sort of we're the problem kind of issue. So I think there's been a lot with regard to Black and Latin, all of our BIPOC community has been just disproportionately impacted. And because of the medical mistrust, waiting as long as possible to get care, which is always a challenge as well.
Yeah, we have another question, I think, to follow up. I think, Nicole, you touched on it very briefly, but how can we get faculty more involved in both acknowledging, anticipating, and responding to student mental health issues?
Yeah, I think at least on our campus, I'd be curious to see, because Ernesto, they require the Cognito program. I think the challenge is a couple-fold, especially in the post-pandemic world where our faculty are fatigued. They were teaching on Zoom and their kids were in the other room. And, you know, the idea of teaching plus trying to take on the mental health needs of the students is a challenge. So working with the faculty of where they are. And I think many faculty want to help. And I wonder if some of it is around the bandwidth of, can I help? Do I know how to help? And how do I do this plus the other things that I've got to do to manage? So I think what I hear a lot from faculty is not that I don't want to or that I don't notice. I'm not sure how, and I'm not sure that I have the bandwidth, you know? And so I think for all of us having some ability to have the grace around how much of a toll this has taken, and how where can faculty make small wins, like proactively mention services and classes and lectures, lean in or really lead with compassion and care with the students, even though that's really hard to do. But proactively is always harder than on the reactive end. Knowing the resources, posting them very clearly, saying that you care and you want to get them where they need to go goes a long way. I think most students would just say, I just want them to acknowledge that we had a pandemic, you know, and I think that that's hard when you're like, yeah, we did. But if I start talking about that, I might cry, you know?
And I would agree. I think that, you know, faculty can start class by spending 5 minutes just doing a brief check-in with students. And if the students, you know, are communicating any type of concern, just to be able to identify resources and maybe offer, you know, after class to help them sort of be, you know, connect them to those resources. At UF, we're very involved in the onboarding process of new faculty and staff. And so prior to the pandemic, the associate vice president that I report to and myself will actually present, you know, do a live presentation to the new faculty. Now it's been condensed into a video that the ABP, you know, conducts. We have updated the helping students in distress, you know, folder, kind of orange folder, given our colors at the university. And we're actually mailing hard copies in this day and age. That hard copy has a letter that it's going to every faculty member that if they're interested in having us come to their department and actually do a session, a seminar, so to speak, on how to actually develop, enhance those skills and help students, we're very willing to do that. And those are parts of the efforts of sort of sharing the load. You know, we all need to be participating in the welfare and you know, looking after the well-being of our students on our campuses. Yeah.
Thank you. And okay, I think we have just a few more minutes. So why don't we do one last question? Maybe we'll get another one after that. But we have a question asking you to talk a little bit more about system level interventions. So you talked a little bit about, you know, faculty trainings, interventions. Another example was pass-fail grading. Folks could move to that. Stress reduction is a university priority. So thinking about like systemically, are there any things that sort of come to mind that you think we should be thinking about that are important?
Go ahead.
I'll volunteer a couple of things.
Yeah.
The first one is for universities to adopt deadlines for projects like papers of 5 p.m. rather than midnight. You know, helping students actually, you don't have to cram, you know, overnight, you know, or be working until late into, you know, 11:59 to submit your paper. Hopefully you're doing that by 4:59, and then you can have a good night of sleep that night. But it will help sort of reset, you know, some of those norms. The other piece is, this is more for faculty and staff, but it can have an impact on all of us, is to have rules about when you send email communication. At our counseling center, we do not send emails between 7 p.m. and 7 a.m. and weekends. It doesn't mean that you're not working. I mean, you could actually be working on an email just to schedule that email to go out the next morning. it's sort of, when we do that overnight, it creates this sense of, oh my goodness, so-and-so, it's working until 2 o'clock in the morning when I was having a really good night of sleep. And now I'm not even enjoying my sleep because I'm concerned that I'm not putting that much effort like everybody else. And so if we can begin to change the culture in small ways, that can go a long way.
Yeah, I would agree with our diverse, large campuses, which both Ernesto and I work within. I think the challenge is accessibility versus setting some cultural tones. So much like this, our Lloyd libraries are often open all night, and which sends a message of accessibility, but not sleep. So how are we really, and the culture around like prioritizing academic studying and how rigorous we're working versus how much we're sleeping? I often remind people one of the best academic strategies for you is sleep. And really prioritizing these in ways that we're kind of juggling this like 24-hour environment. And how do we set subtle tones like this closes? The expectation is you're going to sleep. The expectation is that events don't go past a certain hour and they only start at a certain hour. And I know that there are challenges with that one way or the other because we want to continue to keep our campuses accessible. But I do think there are ways that we need to subtly embed these messages about sleep, self-care, exercise, taking breaks, mindful minutes that we just institutionally adopt that really reinforce that we're concerned about well-being in this environment.
Well, Nicole, I'm going to pick up on that piece you said that you start and stop events in the timeframes that have been advertised. So, hey, I want to thank you both so much for taking the time today, for your leadership at your campuses, for all of the work that you're doing. I know this has been a focus on student mental health, but obviously for everybody, for administrators especially, this has been incredibly grueling. So I just want to, again, give you just a huge shout out for your work, and I wish you all the best. So thank you. For our audience members, I hope you've enjoyed this. If you'd like to join future episodes of Education Now, you can go to hgse.me/ednow. Also, you'll see on your screens a few of the key takeaways that we hope you'll consider after listening to Ernesto Escoto and Nicole Green, that you can bring back to your campuses, your high schools, your families, as we, all hands on deck are needed in this area. So again, thank you everybody for spending this time with us, and we hope to see you again here soon. Thank you.